Yes, hello everyone. Welcome to our webinar this evening entitled Take Control, Inspiring Tools and Tips for Becoming Your Own Diabetes Coach. So our program is interactive. It includes a short presentation followed by an interactive discussion. To type in a question, use the question section of the webinar toolbar. You'll see that to the right of your screen. At the end, you'll have a chance to ask questions. So we look forward to an interactive webinar tonight. Just a disclaimer, we know that the changes you're about to hear may motivate you to make lifestyle changes. So please consult your physician before making any changes to your current routine. The Cecilia Health Certified Diabetes Care and Education Specialist will provide strategies to help you manage your diabetes. This online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health Certified Diabetes Care and Education Specialist. Our webinar leader this evening is Teresa Grasso. Teresa is a registered dietitian and certified diabetes care and education specialist. She's been working in the nutrition field for over 20 years and has specialized in diabetes care for the last 10. She resides in New Jersey with her husband and 3 girls. She leads an active life with her family as they are involved in multiple sports and activities. She's passionate about nutrition and leading a healthy lifestyle and enjoys teaching others how to improve their health. So thank you so much, Teresa, for being with us this evening and sharing with us your expertise. So you may take it away.
Thank you. Thank you. Hi, everybody. So tonight, our agenda, the discussion will include a little bit about why problem solving is important. We're going to review various aspects of how to do your own problem solving to make living with diabetes easier and to help get your blood sugars under control. So how attitude and mindset will play a role in this. Finding information out and seeking support. So where can we find that support we need? What problem solving tools do we need? Problem solving, putting it into action. And then of course, as Katie mentioned, some questions and answers and sharing at the end of the presentation. So we want to look at why problem solving is important. So diabetes needs can change every day. So if we look at different things that may happen in our life, we may have some stress. So stress can be emotional stress. Whatever's going on in our life, we all have some stress, whether it be, the holidays coming up, whether it be, things that are going on with our job, finances, stress is all around us. So it can be, that life stress. It could be stress on our body. So let's say we have an illness or an infection, that's stress on our body, and that can affect our blood sugars and our diabetes. Medication changes or different medications can interact with our blood sugar. So maybe there comes a time where we need some cold medications or some steroid medications for other things going on, and that can affect our blood sugars. Our activity. So maybe there's periods in our life that we're not as active. We can think about COVID and, how our lifestyles changed then. Maybe before we were going to a gym and exercising, and then we got to a period of time where we were kind of locked in and not having as much exercise. Or maybe, something happens where we can't exercise like we were, arthritis or different things like that. So those are all things that kind of change in our lives. So our diabetes needs are also going to change. So as things can gradually change over time in our life, our diabetes needs can change. So maybe there's changes in our lifestyle that are going to affect how we're controlling our blood sugar. By that I mean could be retirement. Maybe we used to be active, we got up at a certain time, we went to work, and now we're retired, and that lifestyle has completely changed. So we may have to adjust things. Maybe we're more sedentary. maybe, again, things like COVID, there was less movement, less day-to-day movement. So even if you weren't a big exerciser, but you weren't getting out every day, so your body just wasn't moving as much. Maybe it could just be changes in the seasons. Summer, maybe we're more active than in winter. So our lifestyle plays a big role in how we're doing with controlling our blood sugars. And we want to remember too, our body changes with age. So that can also be something that we need to look at. But most diabetes situations have a solution. So we have to be creative. We want to not get overwhelmed with it. But, like I said, most problems have a solution. It may take a little bit of trial and error to figure it out. So we're going to talk more about that. But let's say our blood sugars were always really well controlled and within the guidelines, and now all of a sudden they're running higher. So what can we do? Maybe we have to keep a food diary. Maybe we have to keep a better blood sugar log. Maybe we need to start testing our blood sugars a little more frequently when things like that are going on, so we can really kind of pinpoint and see where these trends are, where maybe I'm having some of these highs or low blood sugars, and what we can do to correct it. With diabetes, we also want to remember that it is a progressive disease. So over time, our pancreas loses the ability to make enough insulin. So, this can also be a reason we might find it necessary to change maybe our food choices. Maybe our medications need to change. So, what an important piece to remember is that things change, and maybe what we were on for a long time, medication wise, or what we were doing in our diet, it may not work forever. So we may just have to tweak things and adjust things, because our goal is always to keep those blood sugars under good control, so we're reducing our risk of complications from diabetes. So what we want to think about is putting it into perspective. And we want to be willing to try new approaches. The problem might be not solved by the same method you used before, so being willing to try a new approach. You want to try to be positive. So as I said, before, it may be a little trial and error. So, there could be a scenario where someone says like, oh, I never ate breakfast before. My blood sugar was always really well controlled. It was fine. Why do I need to eat breakfast now? So again, the body changes. So it may be, oh, okay, let's try if I'm having, some of these dips in the blood sugar, say, mid-morning, or if I haven't been eating breakfast and now all of a sudden I'm getting hungrier later in the day and I'm eating more and now my blood sugar is going up. So, whatever the case might be, it's just kind of putting it into perspective and being willing to make some changes. So maybe eating breakfast could be a change that might help somebody. So we kind of look at everything and see what kind of changes may be necessary. So again, those lifestyle changes. Maybe now that you're eating dinner later, that somebody's, your schedule changed. Maybe you have a new job and you're eating later, and now the blood sugar's higher in the morning. So we want to kind of look at all those scenarios that can be going on and keep those good records to see what can we do to make those changes. So kind of considering it almost like a mini experiment. So that's a helpful approach to look at it that way. So definitely keeping logs to see what's working. We're going to get into this more, but a good food log, a good blood sugar log, a good log of putting everything together, like any stresses you're having, what exercise you're doing, and comparing those blood sugars to certain things you're doing in the day, and can really pinpoint what kind of trends are going on. So we'll talk about that a little bit more in keeping records. But change can be hard. It may not be easy to make some changes, but our goal is to, like I said, get those blood sugars to where they need to be. Okay. So we want to remember we're not in this alone. So we think about teamwork and our care team who can really help us. So of course, our healthcare professionals, your doctor, your diabetes educator, your dietitian, so you want to make those appointments, make sure you're up to date on your appointments. You can always discuss things with your Cecilia health coach. You can look for support groups. Those are really, really helpful to talk to other people who may be going through the same thing as you. Um, some support groups are back in action now. I know a lot were closed down with the pandemic going on, but there's also internet support groups. If anybody's on Facebook, you can find like diabetes support groups on there. And on the internet, you can look up, there's a website here, community.diabetes.org/home, and that's somewhere on that you can find some support groups. But always look at your local hospital. They tend to have support groups. If you're involved with like a senior program, they tend to have support groups. So those are different places to look. But just remember, what works for some people may not work for you, and some people definitely follow unproven, possibly harmful practices. So always discuss, whatever information you may get from a support group, especially if it's something like a Facebook support group or, something that has a large amount of people on the internet. Just be careful of, some advice may not be good advice. So just always run that by your primary care doctor or your certified diabetes educator, just to make sure you're getting good information from those groups. Okay, so a little bit more about finding the information. So we do want to make sure that we're looking at reliable sources when we're looking up any of the information we need. So usually good programs are going to end in like when you look up your website, like this one here, org, or .gov are good, reliable websites. If your computer access is limited, whoops, I didn't mean to do that. Okay, sorry about that. If your computer access is limited, you can call this number, and this is a diabetes group. It's 1-800-DIABETES, so that's 1-800-DIABETES, and they have a good printed material that they can send to you. So that's a good one, a good resource to have. So National Diabetes Education Program is a great resource if you're going on the internet. Large healthcare organizations and pharmaceutical companies have good information. Joslin Diabetes Center, Mayo Clinic, American Diabetes Association. There's good magazines, the Diabetes Forecast, Diabetes Health, Diabetes Self-Management. So a lot of these magazines, you can subscribe to them, and they're about $10 to $15 a year. They have a lot of good information, good recipes, so that's a good resource. The library could also be a good resource to you to look up some books. Always ask your doctor or your certified diabetes educator, just to make sure, those recommendations or the books you're getting are, good resources for you. So they would be able to help you with that too. Or if you go on one of these websites, the diabetes.org, you can look up resources or good books on there too, if that's something that you're looking for. So some tools to help us problem solve. So you heard me say this a couple times already, but keeping records is really going to be one of the most important things, or one thing that can really, really help you. Because when we're writing stuff down, or we're, keeping a log on one of the apps, it's a good way to really put it to paper, put it on the screen, and you can really see what you're doing. And the more specific you are in your records, the more you'll be able to see what trends are going on. So you want to look at what you ate, when you ate, how much you ate. You want to include what you're drinking also. And when we're talking about our blood sugars, of course, we're concentrating on our carbohydrates in our diet. And, if we're having any alcohol, we want to jot that down. You want to keep track of your medications, which medications you're taking, when you're taking, and how much you're taking of them. And, what exercise you're doing. There could be days that you exercise that maybe there's a day you exercise more than another day and the blood sugar is going down, or maybe the blood sugar is even going too low. So it might be on exercise days that medication needs to be adjusted. Or you can see like, oh, the days that I exercise, my blood sugar is so much better. So I know that, okay, I'm going to aim to get some activity in every day. So just really keeping good logs, noting times of stress, because stress we know can affect our blood sugars just like it can affect a lot of things in our life. So just noting, if you have a real stressful day, if you're not feeling good, those are all things to kind of jot down in your logs that you're keeping. So you can, if there is stress going on, maybe you can try to do some stress management techniques, some breathing exercises, some meditation, maybe even some yoga, things that can kind of relax you, and to see if that's something that helps your blood sugar. Keep note of anytime you're not feeling well, because that's something to look at too. And then once you have those logs, maybe you keep it for a couple weeks and then you can look back and see what kind of trends you're seeing. Are there certain foods you're eating that blood sugar is going high? Do you find that every day around 3 o'clock you're craving sugar, you're craving chocolate? That's something to look at because maybe it's a case of timing of meals. Maybe you're busy during the day and you're not eating or you're skipping lunch. Now, all of a sudden, every day you're eating some kind of sugary snack at 3 o'clock because your blood sugar is dipping a little bit and you're craving that. So then what would we need to do? We need to go back and say, okay, I need to eat something healthy, even if it's not a big lunch or a full lunch. Maybe it's just a yogurt and some nuts or a piece of fruit, and some nuts, or maybe it's just a half a sandwich because I don't have time to eat too much, but I need to kind of look at that timing of my meals so I don't have big gaps in between eating, because that often is something that leads us to overeating later on or craving things that we shouldn't be eating every day. Um, so we know that studies show people who keep good food records are more successful at also keeping weight off or losing weight and keeping it off. So if you are looking to lose weight, a food record is definitely a good thing to do also. Okay. And for medications, sometimes we don't even realize it and we're missing medications. Again, if we're stressed, we're busy, so that's something too when we're keeping our logs to know, when I'm taking my medication. And we might find, or, I often find that people sometimes forget, maybe they're feeling good and they think, oh, they stopped taking it because they didn't need it. And now all of a sudden the blood sugar's creeping up. And now when we keep these logs, we realize, oh, I'm supposed to take that medication twice a day. And I've only been doing it once. So it might be something like that. Okay, now I need to put an alert on my phone to remind me to take my medication, or put a post-it note, by my fridge to remind me to take it in the morning. Or maybe it's getting a pill box and putting all my medications in them so I can make sure I'm taking the right amount each day. Okay, so you can get logbooks from the meter companies. So sometimes when you get a meter, you'll get a logbook. Usually those are pretty small though. There's online systems, or there's different apps on your phone that are good for keeping those records. Or, sometimes just a good notebook and, pen and paper is one of the best ways if you're a visual person. I like to see things visually. So if it's written out like that and you can really, highlight different things that you need to kind of work on, that's really helpful. Okay, so let's just look at problem solving in action. So we have Sarah here, and Sarah has type 2 diabetes, and she's taking oral medications. Okay, so Sarah had a lifestyle change, and her change was that she recently switched jobs. So in her new job, she's feeling a little self-conscious. She's new to the people around her, so she doesn't really want to check her blood sugars at work. She's kind of hiding the fact that she has diabetes. So with this new lifestyle, maybe I could assume it's a little stressful for her. Everything's new. Maybe her timing of her days have changed, and she's getting home and she's finding that her blood sugars are higher than they should be. So now what are we going to do? We need to try to figure out a way to control her blood sugar, because we don't want to just let it go and say, oh, things have changed. She has this job, the blood sugar's high. We need to figure out what we can do to bring it down, because we don't want it to stay too high too long, because then we could have some complications from high blood sugars. So we want to think about, what can Sarah do? So she needs to find out what's making her blood sugar high. So we don't have that lunchtime blood sugar to kind of help find out what's going on. So what we want her to do is exactly what I've been talking about. We want to keep some records. We want to look at what she's eating. We want to look at her exercise, and we want to look at her stress. Okay, so what we found is her lunch has been pretty consistent. So it's the same as it was before she started her job, but she does have some higher stress levels, learning new stuff at her job, meeting new people. So she's a little stressed. And we're finding that now with this new job, she's walking a lot less. So her physical activity has really decreased. Okay. So what we discussed was that we do really want to try to get that lunchtime or that afternoon blood sugar to see what's going on. So we can get a smaller meter, a faster meter, maybe go somewhere for privacy to check it, the bathroom, or if there's anywhere else, maybe you have to go to your car during lunch, can go somewhere where it's private to check those blood sugars to get some readings so we can really see what's going on. Increasing physical activity. So thinking about, okay, I have this new job, but can I get up and go for a walk? Is there anywhere I can walk at work, even if it's 5-10 minutes at a time? Just building that exercise is so important. If I'm feeling really stressed, what are some, stress management techniques? So maybe it's taking some deep breaths, reflecting on something to calm you down, sometimes thinking of the beach, or something, visualize something that helps you feel calm. Those are some techniques to use. And then we can see what's going on to help bring those blood sugars down. Okay, so what we found, those breathing exercises helped. The sugars were better, but still a little high. Um, what Sarah did was park her car further from the office in the morning. She walked 2 flights of stairs to use a copier on a different floor at least twice a day, and did a brisk 15-minute walk after lunch. So those are some things that increasing that exercise helped her sugar stay in range. Okay, so really just thinking, there's times where we say to ourselves, oh, I don't have time to exercise, because we're thinking, I need an hour. We really don't need an hour of exercise. We can do that 10, 15 minutes at a time. We can do 10 minutes, 15 minutes after a meal, because that can help bring those blood sugars down. And if we do these little spurts of exercise throughout the day, and they add up to that 30 minutes or so per day, that's perfect, because we got to do it where we can fit it in. And that can really, really help keep those blood sugars down. So getting back to a little more activity can help her blood sugars come down. Okay, so you want to just commit to it and plan to continue to increase the exercise, increase that stress management techniques, all that to kind of help that blood sugar. Okay, so basically, what we want to do is realize that diabetes is a progressive disease. It does change. So what we do, may change. Our lifestyle may change, all those things we mentioned. So we may need to change the way we're managing it. So just kind of problem solving, keeping records, and really figuring out what we can do and what areas of our day might need some changes to help bring it down. All right, so now we're going to have a discussion, some questions and answers. If you have a question, I'm going to check and see if anybody typed any in, but feel free to type in any questions. If you'd like to share any of your diabetes management tips that have worked, that would be great, because it's always good to hear from people who are going through it, and you can help somebody else if you have some good tips. Okay, so the first question, my glucose goes way up in the morning, every morning 238 or so, comes down after I wake for 3 to 4 hours. How can I get that to come down? Okay, so I think you're asking how you get the morning blood sugar to come down. So a couple things to look at. So it can be diet related if our blood sugar is high in the morning. So one thing we want to look at is, what am I eating at night? Am I getting up in the middle of the night to eat? I know not a lot of people do that, but some people do. So that can be an easy solution. If I'm eating, late night, I can, cut that out and see if it comes down. If I'm eating dinner at 8, 9 o'clock, maybe I try to move that up a little bit, 6, 7 o'clock, and see if that helps. Sometimes it can depend on what medication you're on, and it might be an adjustment of the times of the medication. The other thing that could possibly happen is sometimes maybe we eat on the earlier side and we don't have anything for a long time. And the way our natural instinct of our body is to keep blood sugar stable. So our body always wants to keep blood sugar at a good level. So what happens is our body does store sugar in our liver. So it stores the sugar as glucose. And sometimes in the middle of the night, if someone's blood sugar starts dipping a little too low, or our body thinks it's dipping a little too low, the body will push out sugar. So it takes that stored sugar and it pushes it out. And then that sometimes is why we wake up in the morning and the blood sugar's high. So there could be an instance, and I don't know if this is happening to you, but where you say, I didn't eat, my, blood sugar was good. I don't understand, how could it be high in the morning? So that's when we kind of look to see if maybe that's going on, that the body is pushing out sugar. So what you would want to probably do is test your blood sugar at nighttime. So test it at bedtime to see where it's at. If it's on the lower side, you may want to eat a little snack. So maybe something that's a little carbs and a little protein is always a good idea. So maybe like a light Greek yogurt, maybe like a small piece of fruit and some nuts, maybe like a couple wheat crackers and a piece of cheese, you know, something like that. And then again, do a little mini experiment, trial and error. When I have my snack, is my blood sugar better in the morning? If I don't have my snack, is my blood sugar better? If I eat dinner at, 6 o'clock versus 8 o'clock, is my blood sugar better? So kind of try to do a little experiment like that. And then, definitely talk to your coach or your diabetes educator, and they can really help you pinpoint, depending on what medications you're taking, to really see, what's going on. But I do suggest checking the blood sugar at night also, at least while you're kind of figuring out what's going on, to see, where it's at bed versus where it's at the morning, and then kind of play around with those foods and times to see if there's anything that can help it come down that way. Okay, so I hope that answers it. If you have have anything to add to that, just go ahead and type it in. Okay, all right. Okay, so we have a good tip. So someone is saying, I'm now chewing slower. It helps me recognize feeling full and fuller more promptly and helps me not overeat. So this is a really, really great tip. Um, what happens a lot of times is we're busy, we're in a rush, we sit down to eat and we eat way, way too fast. And when we eat fast, maybe then we feel bloated. Maybe we tend to overeat because we eat fast and we don't even realize we're full and we're starting to go for more portions. So that's a really great tip. So, chewing slowly, putting the fork down in between bites, not being distracted when you're eating. So we all sometimes pick up our phone or we're watching TV. And if we're distracted, we're really not concentrating on eating. And then that can lead us to overeating too, or eating too fast. So that's like a really good thing to think about is, chewing slower, putting the fork down, trying not to be distracted, and that can really help to make sure we're not overeating. So great tip. Okay. Okay. So hard to read these questions. Okay. Okay, someone's saying, I've been told my live naked, too much sugar to wake me up. I'm not sure what that means. Is that like the drink you're talking about?
Hey, Teresa,
Yeah.
can you hear me? Hey, I think that was the asker of the first question. And he's saying he's been told
Oh,
his liver is making too much sugar to wake him up. That's why his fasting is high.
okay. Okay. So,
Does that
right.
make sense?
Yep.
Yeah.
So that's kind of exactly
Yeah.
what we talked about. So,
Right.
so I think this is Mike. So what I would suggest, Mike, and I don't know if you've been doing this, but check your blood sugar at night. So check it at bedtime, and that will be, a good indicator. If that blood sugar is kind of lower on the lower side, um, before you go to bed, I think eating a snack could possibly be something that can help you. And the other thing is if you're trying with your diet, you're exercising, you're doing everything you can, it could mean that you need a medication adjustment. So that could be, the next step or another thing to discuss with your doctor, because remember, our goal is to always keep blood sugar under control. So, oftentimes I get asked like, which is the worst diabetes, or people say, oh, that person's on insulin. I don't, my diabetes isn't as bad. But that's really not how it works. If you end up on insulin, it does not mean you have worse diabetes or that you failed at doing this and you're doing everything wrong. It's not what it means at all. So, there can be a case if blood sugar is very hard to control in the morning. Sometimes that's an indicator that we may not be making enough insulin and we may need to start taking insulin. So that's something to talk to your doctor about. But there's different types of insulin, and one type of insulin is what we call like a basal insulin, or we think of it as like a background insulin, and it's taken once a day. And sometimes, like I said, diabetes progresses and we might get to the point that we need it. Doesn't mean that we failed at taking care of ourselves or we have worse diabetes. It doesn't mean that at all. What it just might do is help you get under control. So if you're having a really hard time with those mornings, that could be something to talk to the doctor about. Okay, so at 3 a.m., Mike, is the blood sugar, you're checking it at 3 a.m. and it's going low, or is it high then? So if it's low, then, it's about 140 at 3 a.m. Okay. Okay. So, I would try checking it before bed. And then you may need to take a snack then that might help keep it more stable. And then, like I said, talk to your doctor about it. If you can, sometimes using the continuous glucose monitors are a really good thing. I know they're not always covered by insurance, but sometimes doctors will have one that you can wear for 2 weeks. And again, it's kind of like a mini experiment, but those glucose monitors check your blood sugar like every 5 minutes or so, and then they can really help chart to say, okay, is it, what is it, before I go to bed, what's happening in the middle of the night? And then, sometimes if that blood sugar's dipping at night, that's the issue. Then the body starts pushing out that sugar. So those are some things to try for that. Okay. And definitely talk to your doctor and your diabetes educator, further with that, and hopefully can help you troubleshoot some solutions to get that under control. All right. So one other question let me see if there's anything else here. I don't think so. Okay, so one other thing, or one question that I often get asked in the winter is, I can't get as much exercise in, and my blood sugar tends to go up, when it's winter. We have all these holidays, and then I'm not exercising as much, and it definitely goes up. So, one of the things, like I mentioned a little bit before, try to think where I can get these little, bursts of exercise in. So, maybe it's just walking up and down the hall in your house or your apartment for 10 minutes. The other thing is, if you could do that a couple times a day, that's great. Maybe if you're have energy, you go up and down the stairs a few times, if you're stable and you're able to do that. The other thing is looking on, if you have on the computer, you can just type in different exercises. Maybe you want to do a yoga, you can go on YouTube and get different types of exercise, or you could say 10-minute exercise. There's different apps on your phone if you have a smartphone. Another really good one are doing some chair exercises. So maybe at home we don't have a lot of room, or maybe we're kind of limited in what kind of activities we can do because maybe, we have arthritis or in bad knees or hips or something like that. You can do chair exercises. So, basically using the chair and sitting and doing leg lifts, think about using your arms. Maybe you pick up some light weights or 2 water bottles and do some bicep curls, some arm circles. Maybe you're stretching your arms up and down. There's also a really good program called Sit and Be Fit. It's on the PBS channel, so you can either get it on your TV or you could, again, pull it up on YouTube. So that's a good program, Sit and Be Fit. So that's something to certainly, doesn't take any equipment or anything, and you can do it in the house, and it's really good to do in the winter. It's low impact, but just different ways to think about how can I keep my body moving. Maybe it's not as much exercise as I get in the summer months when you're out walking more, but then just thinking, okay, things are changed. It's colder now. I might not be able to go for these longer walks, but I can do 5-10 minutes at a time in my house. And maybe I try to do that a couple times a day to build up to my 30 minutes or so per day. All right, so I do want to share with you our upcoming live events. So if you're interested in any of these, let your diabetes coach know. They can send you a schedule. We have, in January, the new you for the new year, talking about diabetes resolutions that stick. We have February, the all medication tips your doctor never told you. In March, we talk about stop focusing on what you can't eat and learn about what you can eat. And then in April is a discussion on saying no to the complications that can happen with diabetes. So these are all really great webinars that we have. So try to sign up for those if you can. If you want to attend more events, certainly ask your coach. We do have a Facebook page. So if you're on Facebook, please go onto our page and like it and follow us there we have really great blogs and information, and then there'll be information on these webinars also. Okay, so thank you everyone for joining us. We appreciate your attendance, your participation. Thanks for all the questions. And I hope everyone has a really great holiday season and Happy New Year. Thank you. Have a great night.